Hi, welcome to the agent training for the Medicare Exchange powered by ConnectSure-DRX. For this training, I'm going to take you through all of the features and functionalities throughout the platform that you will need in order to quote and enroll members. Upon logging into the dashboard, you'll be taken to your dashboard here. So from this point, you can manage enrollments, quotes, scope of appointments, MyMedicare.gov connections, or any other tasks that are associated within your book of business. You also have access to some reports that you can view that are associated with any enrollments, quotes, or scopes that you've processed within your book of business. We also have some agent training materials. So in this section, you'll be able to see some documents and then some short videos that show different features and functionality throughout the site. Whenever agents first log in, we always like to stress they go to their account overview. To get there, they'll click up here at the top. Then they'll scroll down, they'll see account overview. This is where agents can access their personalized URL, so that consumer shopping link here, so they can copy that link from this page. They can also upload a photo of themselves. That's going to be included on any communication that's going to be sent out from the platform to members, so a quote, a scope of appointment, or a text or email to enroll. You can also see your personal information and then any account information associated with your profile here. And all of your active selling permissions are going to be listed down there at the bottom. We'll go back to our dashboard. So from here, if we are working with a new member who is not within the platform, we just select New Profile, and then we just select New Beneficiary, and then that's going to take us to our member profile screen where you can enter in all of that demographic information for that member. If you have Part A and Part B effective dates, you can enter that information in. That'll be tied to that member profile as well. Home address, and if there are any other sales contact information for that member, you can enter that here. For this purpose, I've already preloaded a member for us. So if we were logging back in and looking for a member that we had already worked with in the past, we would just select Search for Beneficiary. That's going to bring up our Search for Beneficiary page here, where you can search by first name, last name, date of birth, phone number, confirmation number, or any combination of those. So we'll pull up our beneficiary here. So as you can see, I have two profiles here. So this may happen if you have a duplicate profile loaded. Then I can see here, applicant. This identifier just kind of lets me know that I've worked with this member in the past, possibly entered some preferences, and began shopping and enrolling this member. Registrant just means that I've entered in this member profile information, but I have not shopped, quoted, or enrolled this member in a plan. So for today, we're going to be working with Mr. Rasmussen. So we'll click on that member profile from here. That'll take us to that member's profile where we can double check all of this information. So we can confirm this information, make sure all of this is correct with that member, because this will pass through to the enrollment form, and it also pre-populates on that scope of appointment form as well, saving that member some time entering all of that information. If we had worked with this member in the past, we would see any notes or tasks associated with this member here. We scroll down to the bottom. If we had sent that member a quote, that quote would be located here along with an enrollment. If that member had enrolled in a plan, then we'd be able to download a PDF copy of that enrollment here. So from this page, we can go ahead and continue on to our scope of appointment. You select Continue to SOA. That's going to take you to the scope of appointment page where you can do this in three ways. You can either email or text for that member to fill out that SOA, or if you're doing a traditional in-person meeting with this member, you can print off a copy of that SOA, fill that out, scan it, and then upload it directly to the platform. For this purpose, we're going to email that SOA. So I'll select email. That's going to give me a confirmation here, and then it's going to prompt me to create a task on my dashboard here so we can follow up on that scope of appointment. So we'll just add that task there, close that out. This is the email that member will receive. So you'll have the branding up here at the top. You also have a personalized message for that member. And then if you have your contact information and photo, then that information is going to be loaded here. So that member would just select Complete Scope of Appointment Form, and then that's going to take them to the scope that is hosted on the ConnectSure platform. So we just come here, fill out all this information here. You'll notice their demographic information is preloaded there for us, so that member is not going to have to re-enter that. And they would just select Submit Form. From there, they'll get a confirmation page just letting them know that here's some things that they might need for their meeting with that agent. Now, if we go back to our dashboard, we'll notice that we now have a task loaded here. So we have a follow-up on that scope of appointment that we just sent to our member and a due date for that task. So we can click on that member's name, That'll pull up that member's profile. Now again, if this member does complete that scope of appointment, you will get an email notifying you that that member had completed that scope of appointment, so you can log back into the platform and look that up. So once we're here, we'll go to continue back to SOA, and then we'll see where that scope was completed by our member there. And then the agent can go ahead and complete their portion of the form here by just selecting complete form, and then filling out all of the necessary information down here in the bottom as well. Once we submit the broker form, then we'll see that that SOA is fully completed. It's going to store that to that member profile here on the SOA page, but you can also view and download a PDF copy of that and save that for your records as well. Once we're done with our scope, we can go ahead and continue to plans. Once you select continue to plans, that'll take you to our plans list page. So on this page, you'll see the total number of plans that are available within that member's zip code. You also have that broken down into plan type. So we have MAPD, MA plans, PDP, or MedSup. Down here we have some sort options, so we can sort those plans based on plan premium, Medicare star ratings, plan name, deductible, maximum out-of-pocket. We also have some filters over here on the left. So if you wanted to filter plans by deductible, maximum out-of-pocket, premium, add-on, or filter by carrier, you could do that as well. Here we have our plan cards. So on the plan card, you'll see that carrier's name and logo, that plan name. You're going to see the medical deductible, maximum annual out-of-pocket, monthly premium. From this page, we can go ahead and add 3 plans to a quote here by just selecting Add to Quote, and we can send that to that member directly from this page. If we already know what plan that member wants, then we can go ahead and add that plan to our cart, or we can view the plan details, or if we're working face-to-face, we can add up to 3 plans to compare side by side. And that would take you to your Compare Plans page. For a more personalized shopping experience for that member, and to go ahead and load in their providers and prescriptions and pharmacy data, then you come down here. We call this a guided shopping experience. So from here, we would just select Add Preferences, and that's going to allow us to add in our health information, provider information, and prescription and pharmacy information for that member. So we'll see here at the beginning we have our Get Started page. So on this page, we're going to have our zip code, which will pull through from that member profile. Then we have the coverage that we're interested in, so we can select MAPD. Then it's just going to ask you some rate factor questions. This is just letting that system know if that member might be eligible for any special assistance. For this purpose, we say no. Our health page here is going to give you 3 different options. You can choose generally healthy, some health needs, or significant health needs. And there's some descriptions down here in the bottom to help us understand what exactly each one of these identifiers mean. So for generally healthy, we're looking at no major illnesses, less than 2 prescriptions for an illness, and then less than 2 visits to a primary care. And then down here for the age range, that's going to pull through for that member profile as well. So from here, we'll continue on to our provider search page. So our provider search tool is integrated with Google Maps. So the tool here, like I said, is integrated with Google Maps. So you can search the map to find a provider. We can type a name here in the box. If a provider does not show over here on the left-hand side automatically, you could just zoom that map out and then select Search This Area, and then that'll pull from a larger area here. So we can toggle this map and find a provider that way. So we can add a provider from this screen, we can add a provider from our map here, or we can type in up here on the top, and you can search for facility. You can search for facility and name, any combination of the two. So we could do internal medicine and Smith, hit search, and then that's going to pull up any Dr. Smith or a internal medicine facility within that area. So we can go ahead and add some. Now once you have your providers added, you can scroll down here, and this is where you can select one as that member's primary care provider. So we can just select one of these for a primary care and select Continue. That's going to bring us to our prescriptions page. So our prescriptions page, we can either type in those prescriptions up here at the top bar. Usually, if you get within the first 3 or 4 letters of that drug, it'll pull it up from our predictive text list. Here we can select the quantity and frequency of that drug and go ahead and add that to our drug list. Now, another way we can add those prescriptions is through a mymedicare.gov connection. So if that member has a mymedicare.gov account, we can import all of their prescriptions and all of their drug information directly into the platform here, and I'll show you what that looks like. So we would just send an email to that member's email here. We'll get a confirmation along with a task to add to our dashboard to follow up on that. So we can add that task. We'll close that out. The member is going to receive an email that looks like this. You'd have the branding up here at the top. Again, your agent information along with that photo is going to be listed here. That member would just select log into mymedicare.gov, and that's going to redirect them to the mymedicare.gov site where they will put in their username and password. Once they select login, they'll be prompted to share their data with ConnectSureDRx. They can just click allow. And once they click allow, it's going to import all of their drugs. Now, this information comes from claims data going back 18 months. So if there are some drugs that that member's not taking anymore, then you can easily edit the quantity and frequency or take those drugs off of that list altogether. So once all of those drugs load, they'll see them on the list here. As you can see, the member we have here for my demo login has quite the medicine cabinet. And they'll see a confirmation here, just letting them know that those prescriptions have been shared successfully and that they can close their browser. Once those prescriptions have been shared successfully, that agent will receive an email confirmation letting them know that the member that they were working with had shared their data from mymedicare.gov. Once they receive that email, that agent can log back in, pull up that member profile, and come right back here to the prescriptions tab in the guided help section. And when they come back here, they won't have to refresh the screen. That will automatically refresh. But once they come back to this prescriptions tab here, they'll see where those prescriptions have been shared successfully. And that agent can go ahead and import latest prescriptions. Once those prescriptions load, they'll see that full list here. We can go ahead and click Continue to Prescriptions. And then that's going to load that full drug list on our Prescriptions tab here. And again, if that member is not taking any of these drugs or some of these drugs, then they can easily just exit these out of that list here just by clicking the X on the right-hand side. Or they can click Edit, and they can edit the quantity and frequency of those drugs if that may have changed. So I'm just going to exit out some of these drugs here, and we'll just keep one in for now. So once we're done with our prescriptions, we can continue on to pharmacy. Our pharmacy search page works similar to the way the provider search tool does. So we can toggle the map here, and again, if you don't see any pharmacy results right away, you could just zoom out on that map, click Search this area, and zoom out a little bit further, and then those pharmacies will appear here. And we can add those pharmacies from this list here, or if you want to search in the top bar here, we could just type in that pharmacy name, and then it's going to pull up any of those pharmacies that might be nearby. We can add those to our list. Now, we can add up to 3 pharmacies here on this list. Mail order pharmacy will always be included on the plan's list page. So that brings a total of 4 pharmacies that you have the ability to choose from. So here we can set one as a primary pharmacy if we wanted to do that. Once we have that selected, we can continue on to our next step. That's going to bring us to our other preferences. And this list here is largely going to be based on that member's zip code. And these are just rate factor questions, letting us know if that member is interested in hearing, vision, dental, or Part B give back, then any plans that have these optional add-on benefits available will show higher up on that list. For this purpose, we're just going to say none of these. Or you can skip any of these sections here in the process if you don't have that information or that member doesn't wish to provide it. Once we're done there, it'll ask the same for chronic conditions here. We just click Continue, and that'll take us right back to our Plans list page. So now that we're back on our Plans list page, you'll notice that some information has changed on our plan cards. So here, it's going to let us know which of these providers are in network or out of network for each individual plan here. So if these providers were in network, you'd see a green check mark next to those names. It's also going to let us know what prescriptions are covered and which ones are not. Again, this prescription is covered, so we have our green check. If it was not, you'd see a X here. You also have your pharmacy information, so that's going to let us know if that pharmacy is standard in-network. And you can toggle between the pharmacies here on this list as well to see if it's standard or preferred in-network for these plans. So here, once we have all this information entered, we can, if you wanted to resort, we can sort by preference score, plan name, total estimated cost if we wanted to do that. We could add these 3 plans to a quote from this page here. So let's say we wanted to quote these 3 plans for our member there. We can go ahead and send that quote. Now you can send a quote in 2 different ways. We can email or text, or you could do both. We can add a personalized message for that member here. So the site's fully responsive. It's going to fully render no matter what device that user is using to pull that quote up on. So they can actually view the quote and enroll themselves in a plan, sign and submit that app on a tablet, a cell phone, or a desktop. It doesn't matter. So we can add a personalized message here. It's going to ask which pharmacy you'd like to include with that quote, and we can go ahead and send that quote. When we send that quote, it's going to prompt us to add a task to our dashboard here. And we can go ahead and add that task, and we'll close that out. Now coming back here, if we were working with a member face-to-face, we wanted to show these plans on a compare plans page side by side. I already have them selected here, so we'll just click compare now. You could compare up to 3 plans side by side on our compare plans page. So that's going to pull up some of our costs and benefits associated with these plans in a side-by-side view. Again, you can toggle between the pharmacies on this page as well, or you can send a quote from this page as well if you wish to do that. So here we have some additional information regarding these plans. Any differences between the plans are going to be highlighted in yellow here. So we have our estimated drug costs, our health costs, and total estimated cost. Now this total estimated cost and health cost is going to be based on our effective date. So here it's showing us a partial year, and I'll show you a little bit more about that information here in a second. So down here at the bottom we have our benefits, so our medical coverage, medical deductible, maximum annual out-of-pocket, and again, any difference between the plans are going to be highlighted in yellow, make it easy for us to spot. Now this is an omni-channel experience, so when I go to view our quote that we sent our member, you'll notice that when that member compares these plans on that consumer-facing page, or if a member is shopping and enrolling themselves through your personalized URL, their shopping and enrollment experience is going to be exactly the same as what we're seeing here. So they would see all of this information. Their page, that consumer-facing page, is going to look exactly like this. So we have our emergency room. Then you're going to have prescription drug coverage. Scroll down to the bottom. We're going to have our provider data. So it's going to show us which providers are in network or out of network for specific plans. It's also going to show you that prescription data and pharmacy data for each specific plan here. Now, if that member wanted to view the plan documents, then we would have to go to that plan details page, which I'll show you up here at the top. So say our member is really interested in this United plan here. So we could just click Plan Details. That's going to take us to our Plan Details page. So on the Plan Details page, you'll be able to see a lot of the information that we just saw on that last page. So we can see cost, we can see benefits. Scroll down to the bottom, our medical coverage, and then you can actually access those plan documents down here as well. So important documents, summary of benefits, enrollment applications, star ratings, any of that information is going to be listed down here. Now, if we come back up to the top, we can actually toggle between these tabs here. So we can actually view our prescription cost, and this is going to give us a better breakdown of how much those drugs cost, and then if there are any restrictions with these drugs here. So we have quantity limits there, so 150 to 30 days, step therapy, or if there's prior authorization needed here. And even here, you can toggle between these pharmacies and see how those drug costs change based on the pharmacy that you have selected. From here, we can go over to our total cost tab. So this is going to show us a month-to-month breakdown of how much that health coverage is going to cost that member. So we have our premium, our drug cost, and then that estimated health cost is going to be listed here. And that's going to bring us a total monthly estimated cost for that member here. And again, this is based off of a effective date of May. That total estimated cost is. And you can toggle that effective date here. And you can see how that total estimated cost changes based on the effective date that member chooses within that drop-down box there. So from here, I'm going to take us back to our dashboard, and then we're going to view the quote that we had sent to our member a little bit earlier on in the training. So the quote that member receives is going to come through in 2 emails. Again, the first email they get is going to have an authorization code. So that member can copy and paste or write that code down. We'll go back to our other email. The second email that member receives is going to be the quote. Again, you have the branding up here at the top along with that agent information at the bottom. That member would just select View Quote. That's going to take them to this page where they enter in their authorization code. Now this is, I'm using a staging site here, so this window here is not going to populate for that member. This is just for my login. So that's going to take them to their site here where they just put in that authorization code that we just copied and pasted. click Continue. That's going to bring that member to their quote here. They'll see their personal information that that member has entered, that agent has entered. They're also going to see their preferences here, their health, extra help, providers, prescriptions, and pharmacy information. So once we sent that quote out to our member, if that member does decide to select one of those plans and self-enroll in that plan, the agent still receives credit for that enrollment. If we do not receive an update that member has enrolled in a plan and we want to follow up with them after we send that quote, we can just log back into our dashboard and we'll see that quote here where we have a follow-up with our member. So we can just click on that member's profile. That's going to take us back to that profile page here. We have all the notes that are associated with this member's profile now, any tasks that we've had associated. We'll also see the quote that we had sent that member here. And then the access code associated with that quote. So if for some reason that member loses this access code or that first email and they want to be able to get in and view that quote, there's no problem. They can just contact the agent, and the agent can go to their member profile where they can access that authorization code here listed in that quote. So let's say our member was really interested in that United Healthcare plan. We could just go back, continue to plans. When we go back to the plans list page, we can find that United plan that member was working on. Now, if that member had already started an enrollment for that plan, then you would see it. You would see this plan listed at the bottom under enrollments on their member profile, and you would just select a button that says continue enrollment, and that would take you directly to the enrollment form. If not, we could just find that United plan here. We can add that to our cart. And once that plan is added to our cart, we'll see that here, where we could go ahead and select continue to apply. That agent will receive a message here letting them know that they'll be redirected to that carrier's enrollment form. Once that loads, we'll see the enrollment form here, where we have all that contact information. Again, this information is going to be preloaded from that member profile, so it saves us some time on this end. So we won't have to re-enter any of this information here. So we just scroll through this, enter our member's personal information, mailing address, any emergency contact information here. And again, if something is required, you'll see a red asterisk next to that question. We can select next. That's going to take us to our benefit information, where we will enter in that member's Medicaid ID number. Once we have that number entered here, now again, if there's a incorrect format for that number, it will let you know here, and it will not allow you to continue forward. Once we have all the required information entered here, it's going to scroll down. It's going to ask for any special enrollment period questions are going to be listed here on that form. So we can scroll down. It's going to have coordination of benefits, long-term care. Again, these questions are required. You'll see the red asterisk next to them, next to that question. We can continue on to that next page. The next page is going to have some other information. So physician selection here. Now, if this is in a production environment and we do select a primary care physician, then that physician will be pre-populated on this section of that enrollment form if this question is a question that's included on that carrier's form. Scroll down, we're going to have our payment option here. For this purpose, we can do get a monthly bill. Now, the enrollment forms are different, carrier to carrier. So some may have, credit card or ACH, or get a monthly bill, and some may only have one or two options. For this purpose, we're going to say get a bill. We have our language preference for that member. Once we select next, it'll take us to our review and submit page. So from here, we can review any of the information that we had pre-entered for our member there. Scroll down to the bottom. Now, if we're working face-to-face with that member, then we can go ahead and select the attestation, have that member sign that form. So we do support wet signature. So again, if this is a face-to-face enrollment, then we just select I'm the beneficiary here. Understand we can have that beneficiary collect a wet signature here, or if they cannot, then they can simply type their name into this box. Once that's signed, we can go ahead and select submit. Once that application is submitted, we'll see a confirmation page here. Now that member will receive an email confirmation. There will be this confirmation page, and the agent will also receive an email letting them know that this member or that this application has been completed. On this page, we can see our confirmation number. We can view and download a copy of that application, or we could email or print a copy of this confirmation page here. Just to highlight a different form or a different way that we can submit these enrollments. So the last use case was if we were working with that member direct face-to-face. If we wanted to do this remote, so we can actually send the application to that beneficiary to sign and submit, then we would select that option. Then we could scroll down here. You have the attestation there. And then at the very bottom, we would see a send to beneficiary to sign and submit. For this purpose, we could send that to that member. Again, we could do this in two ways. You can text or email, or you could do both to that member. So if they don't have a phone that can access the internet, that we can easily email that to that member. Or if they don't have an email and they have a phone, that we can text it to that member that way. We can also include any of these PDFs in that email if we'd like to do that. We'll just send that application. And again, that'll prompt us to add a task to our dashboard to follow up on that application later on with that member. So we just add this task to our dashboard. Once that task is added, we close that out. We go back to our dashboard here. The email that that member will receive will come through similar to the way the quote does, so they can copy and paste that code here. Then they can come here and they can select View Application. Then they will just copy and paste that code into the authorization box here. Once they put that code in, they'll be taken to that Review and Submit page of that enrollment form, where that member can double check their contact information that they've entered here. They could scroll down to the bottom, select the attestation, and then again, we collect a wet signature this way, or they can type in their name here in this box, and then they click Submit. Once they click Submit, that agent, again, the agent will receive an email confirmation, and the member will receive an email confirmation of this confirmation page here, where they have the confirmation number. When that application was submitted, they can view and download a PDF copy of that application, or they can email or print this confirmation page here. So now that we've fully quoted and enrolled our member, you'll notice that all of the tasks associated with that member has fallen off of our dashboard here. So once we receive an email letting us know that that member has enrolled in a plan, if we wanted to go and pull that PDF copy of that application, we could just search for that member here by clicking Search for Beneficiary. Type in that member's last name or first name. Then we could select that member here from this page. And again, all of that information is going to be tied to that member profile. So again, we'll see our notes that are associated with our member here, our quotes. Again, if that member had started an enrollment and not finished, like I was saying earlier, that we could continue an enrollment for that member. So any partial enrollments will be saved here. If that member had completely finished an enrollment, then we can view that enrollment here with that confirmation number, and we can view and download a PDF copy of that application as well from this screen. That concludes the agent training for the Medicare Exchange powered by ConnectSure DRX.